Dr. Chen, it's great to have you with us. This is Dr. Gordon Chen.
Great to be here.
ChenMed. And I want to say, first of all, thank you very much for being an ally organization to BMA. And we've worked closely over the years in telling the story of Medicare Advantage and the incredible work you do. So thank you for all that you've done with us and your partnership and for your sponsorship of the summit. We're doing it virtually this year, so a little bit different, but hopefully attracting an audience that's attentive to all the things we are going to hear during these couple of days. It's really pretty exciting what's going on in Medicare Advantage, and we're going to talk about that. So let's start telling us a bit more about ChenMed. Some of us know it well, but some don't, and really about what drives the mission, which I feel you were very mission driven, and it's a good family story, an important family story to tell in that, and why you do what you do. So let's start there.
Fantastic. Well, ChenMed starts with a mission. Unlike healthcare organizations that are birthed out of private equity or venture capital, and they're really created to generate a return, ChenMed was birthed out of suffering. Our mission is to help seniors in poor, forgotten, impoverished communities, avoid the suffering that we had as a family full of doctors, we had to endure. And here's what I mean. My dad was 54 years old when a CT scan revealed a 5-centimeter golf ball sized mass behind his nose. And the doctor said he had an incurable carcinoma and less than 2 months to live. And as we came to grips with Dad's diagnosis and struggled to make his remaining days count, we realized that despite all of our medical training connections in the field, the healthcare system, which we had devoted so much of our lives to, was working against us. And Dad was at the mercy of a broken system that really burned out doctors and incentivized sick care. And we felt helpless and vulnerable. And we knew that seniors across America with far less than us would not survive a similar situation. And so Dad got a second opinion. The initial diagnosis was wrong. And through God's mercy and grace, he survived. But the experience ignited this passion for making healthcare right, for all the people it's supposed to be serving, and I think that's what makes ChenMed different. And so we want to be this organization with strong business principles. We also want to make sure that as we're generating earnings, those earnings will fund our vision and our mission to allow us to be able to multiply our impact and transform care for the neediest populations.
Okay, well, it's a powerful way to start, that's for sure. And it seems like you've been able to really keep up that sense of mission and have grown quite a bit. Obviously started in Florida, you've grown now to, you can tell us how many states and how many medical centers. I've been to visit one of your centers, and really impressed with the, not the sense of mission, but also your ability to bring your staff together, to bring doctors together who really share this passion. And so I just wanted you to talk a bit about that. How have you been able to grow a real change in the way healthcare is delivered in a way? It's really away from fragmented healthcare, really looking at patient-centered care, being able to look beyond just the clinical care, really create a warmth and understanding within your health centers as well to, of what, the attention that patients are going to get. And many of them have complex chronic conditions. Many of them have struggled with for many, many years. So the goal is, of course, to reduce disease progression and to get people healthier. But it really was you got a sense of that actually, even as a visitor for just a few hours. So tell me how you sustain that, both how you attract staff, how you train them, how you reoriented them to this kind of transformation in healthcare, and how you maintain that.
It's amazing. We have a tremendous amount of passion and love for what we do, not only as a family, but also all of the talent, the amazing doctors and leaders and team members that we're able to attract. And we're very upfront with everyone about who we are, what we believe, who we're serving, and really what our mission is. And we attract people who share our vision for healthcare and believe in our mission. And they want to be a part of something bigger than themselves. And they are some of the most passionate doctors, leaders, and team members working in healthcare today. And the best part of it is they can fulfill purpose, which is so important, right? Having that fulfilling purpose, but then also have personal opportunity. So it's a great win-win for them.
That's great. That's great. Well, I know it's centered on primary care, but you have a few specialists now because so many people have particular chronic conditions. But let's move on, and I'm sure we'll hear more about exactly how you do it. But we were very impressed at BMA, and we talked about the work that you did early on. I called our ally organizations across the country. It was really pretty dramatic time for all of us in healthcare, but as BMA works on federal health policy, we want to know what you were doing well, what the barriers were, and what kind of changes we wanted to see at CMS or from Congress. And we did get quite a good response from both Congress and CMS during this whole period of time, but we really highlighted some of the things you did. So tell us a little bit about how you were able and did really act on meeting seniors' needs at the beginning of COVID and now throughout COVID-19 and the pandemic we've all been living through.
This pandemic has really changed everything, right? And
it certainly feels that way personally as well, right? Doesn't it?
And speaking on behalf of the communities that we're serving really poor, underserved, needy communities. And we know that this pandemic has impacted minorities, particularly African Americans and Hispanic populations, at a much higher rate, both in terms of infection and mortality. In fact, the mortality rate for Blacks from COVID-19 is 3.8 times more than whites. Among Hispanics, it's 2.5 times more than whites. And you see this clear disparity, and you have to ask yourself why. Right? And the answer comes down to, a lack of trust that they have in information, either from the government or the burden of chronic disease that they carry, and also their inability to protect themselves in crowded home and crowded work environments. Mm-hmm. And in the communities we serve, we've worked extra hard to educate and support our patients throughout this pandemic. We went to more than 90% virtual appointments from in-person to virtual in less than a week. We started making what we call quote unquote love calls to our patients. And that's where we call them every week to educate them, ask them about their needs, really just tell them we care about them as well. And when patients had needs, we went out and did everything we could to meet them. For example, if they were too scared to leave their home and they needed toilet paper, we went out and bought it for them and delivered it for them. Wow. And so these love calls, they were very effective in curbing the transmission rates. As a matter of fact, the transmission and mortality rate from COVID-19 among our patients should have been much higher because of where they lived and the complexities of their diseases. And we saved thousands of lives in the most vulnerable communities because of the amount of work we put into earning our patients' trust.
Mm-hmm. And on making sure they could stay home and still get their needs met, So that's really quite something. And it will be interesting to see those numbers. Honestly, that's going to be the kind of story that we are really curious about, whether people were postponing care during COVID, whether they got the care they needed when they needed, because you still had medical care needs, you still needed medications, you still needed to get prescription refills, you needed, and obviously so many healthcare providers stepped up. But we did a study at BMA on telehealth, and really did show that both because Medicare Advantage providers had some experience sometimes with telehealth. They had a platform to build on. They also had a list of patients by risk. I think that's how you talked about doing it too. Go down the list and call absolutely everyone. And it sort of was a system in place where you already were building that kind of trust with patients. It really is, it continues, obviously, the concerns about health disparities. I mean, can you speak to really, where do you think this takes us from now? This is COVID. We hope that this is a period of time and not forever. We hope there is a vaccine at some point and then a treatment. And we're seeing clinicians doing a better job of understanding, or their experiences led them to understand COVID and be able to come up with better treatments for those who get particularly sick with COVID. But how do the MA has been very interested in this and concerned about it because Medicare Advantage has more, well, because it's right, but also because Medicare Advantage has a higher percentage of African Americans and Hispanic seniors than traditional Medicare. It's almost a responsibility, but also an opportunity to use the framework of Medicare Advantage to address health disparities. How do you feel like this will lead to a better understanding of how you actually build that relationship with the Black community, with the Hispanic community, and to build that kind of trust in the system and access to care?
Yeah.
As well as understanding of the social risk factors and clinical risk factors that many minorities have historically had in higher numbers.
Yeah. Well, healthcare in poorer neighborhoods in many ways is set up to fail. These communities, they have fewer doctors per capita, and there are differences in the treatment of minorities, when they do receive care. People in these neighborhoods are exposed to pollutants. They have fewer educational resources, less disposable income to enable healthy living choices. And there's a lack of trust with healthcare in society. And these barriers lead to very predictable differences in outcomes. The people in these neighborhoods can live 20 years less than people in wealthier neighborhoods just a few miles away. And that's social injustice. The current healthcare model is set up to make money off wealthier, well-insured Americans, and hospitals and medical practices. They need to drive sustainable business. And so they're going to build their facilities where the wealthier, well-insured Americans live. And there's nothing wrong with that. But the current system does not incentivize anyone to take care of patients with the greatest need. And I love Medicare Advantage and the model that allows us to bring, because it allows us to focus on where the need is and allows us to attract talented clinicians and leaders and team members to meet the needs right where they exist. There's room for both systems, fee-for-service and a value-based system. There is room for both in America, but we need to shift aggressively some of the focus away from fee-for-service and towards value-based care, where there is accountability for outcomes. And then we need to create incentives to attract the talent needed to take care of patients who have the greatest need.
Oh, all right. Well, that's Medicare Advantage does offer that opportunity, and we share with you the feeling that fee-for-service has a role. Clearly, it is moving to a more integrated system of care. Getting away from that fragmentation and being able to really look at patients not in an episode of care or quality of care in an episode, which is in itself important, but not enough. That it is really about building a relationship with patients over time. Particularly, we're going to conquer some of these chronic conditions. Is really the task of the future. You speak about the whole issue of social injustice, and we've also seen violence in the streets. None of us condone violence. Certainly I don't, but we support law enforcement, the important role they play. We do understand and support certainly civil disagreement and demonstrations, but we know it has led to some really difficult situations in some of the very communities where you have your health centers. So speak about how you've handled that too, because here you've worked to develop the relationship with patients, and yet I assume some of your medical centers were really vulnerable in some of these communities.
That's right. We feel it, not just because our patients feel it, because our staff feels it also. They live in the communities where much of the rioting and social unrest takes place. And it's very emotional for us, especially when we've had to even shut down centers temporarily in Atlanta, Philadelphia, Chicago, and in Louisville. But the social unrest of 2020 has really energized us. We made a conscious decision not to back away from it, but rather respond to it with love, not hatred or anger. And we respond with our words and actions. We continue to reach out and check in on our patients, see how they're doing, help them to deal with the anxiety and the isolation. We're even helping our patients register to vote and learn where their polling places are so their voices can be heard. Mm-hmm. And even through the social unrest, through a pandemic, we continue to grow.
You've been through a lot. I mean, I think the whole country's been a lot, individuals have been through a lot, but certainly healthcare providers, clinicians such as yourselves have really been on the front line. So I think what sometimes got lost, particularly early on, is obviously all the attention had to be, are the hospitals prepared? How do you close down elective surgeries? How do you, get people not to come in? How do you close down medical offices? I'm sure you had to do some of that. But as we both continue to deal with COVID and to take that seriously during this next, I assume, many months, you're right that you have such a spirit and positivity about moving forward that we can actually learn lessons from all of this. So it sounds like you've said some of it already, but anything else you want to add just about lessons learned in this? I love the fact that you talk about not backing away, that this is about moving forward toward that mission. Anything else you want to say, particularly as we look at what else could we be doing at BMA, or what else Washington policymakers ought to know as we go into 2021 or get through the next few months and go into 2021 about lessons learned for the healthcare system for the future?
I think we need to recognize that change is needed. You see, there are neighborhoods across America that have incredible burdens that we need to help meet. Mm-hmm. And so how can we close all of these huge gaps in disparity? One, I think we need to start building from a mindset of taking care of people. And Medicare Advantage allows us to shift our focus to take care of people and drive towards better outcomes. For us at ChenMed, we start with closing the gaps in healthcare disparities. Obviously, that's what we feel that we can do well. We can't do everything, but what we can do is we can bring great doctors and healthcare to communities that are sick and suffering. Next year, we're planning on adding an additional, 25 to 35 medical centers in different communities. The year after that, we're aiming for 40 to 50 new communities that we can serve. And we know that we can improve health and reduce unnecessary hospitalizations by 30 to 50%. And we believe that our model helps patients live about 5 years longer. And the quicker that we can get our model out to communities that are hurting, the quicker that we can eliminate the disparities and social injustice.
Well, I know you're already at 75 medical centers, and so growing pretty rapidly. Well, really, again, appreciate not only the work that you do every day and your staff does every day, but the fact that you've been willing to think about the policies and to think about how to advocate for your patients in a more, I would say, political way, in a way, without party affiliation, but really be willing to say, work with us at BMA about telling the story of really being able to communicate with members of Congress, and the writings you've done and the reportings you've done have really been very important to tell this story. Medicare Advantage, is up 40% of beneficiaries and growing itself. So that beneficiaries are also playing a role in saying this is the kind of care we want. So it's kind of a win-win. That's the idea for everyone, is to get that kind of healthcare to the most needy seniors. So thank you for what you do every day. Thank you for your involvement with BMA, and best wishes to you to be safe, and to your staff, and to all your patients to continue to do the important work that you're doing.
Thank you so much, Congresswoman Schwartz. And, it's really our pleasure to partner with you guys and make for, better change, across America, starting with healthcare and what we can do for the neediest communities. At ChenMed, we really we really believe that it is our purpose to spread love and promote better health in all who we come to contact with. And we thank you for the opportunity. May God bless you guys and what you're doing, and really appreciate all of your support of ChenMed.